How's it going? It's Dr. Greg Marion here at One Spine Chiropractic. Today we're going to be discussing how One Spine Chiropractic is here to help you throughout your pregnancy. A lot of times we hear is, oh, my back hurts, my hips hurt, I have sciatica. So that's one of the reasons a lot of our prenatal patients come in here. Another reason is they want to be...
Sorry, can we start?
Yeah,
Let's go.
cool.
Let's go. Okay, here we go. 3, 2, 1.
How's it going? It's Dr. Greg Marion here at One Spine Chiropractic. Today we're going to be discussing our prenatal patients and what they do here to get the relief they need so they have a happy, healthy pregnancy. A lot of complaints we hear when they get here is, my hips hurt, my back hurts, I have sciatica. Another thing is we see a lot of patients in here that want to be proactive and have a healthy, happy delivery. So they get in here early, make sure the pelvis lined up properly, and they're able to function the way it needs to, make the delivery process easier as well. But what we do is we like to start off with a thorough consultation to see what your body's been through. We want to make sure there's no old injuries, anything that could be hindering from us treating you, but more importantly, we want to keep you safe. The second thing is we want to see what your health goals, but more importantly, your pregnancy goals are. Like we mentioned before, you might be in here just for pain, which we're great at getting rid of pain throughout your pregnancy, but you might be here to make sure your delivery and your labor process is a lot easier by making sure the baby's in the correct position. That way the delivery could go easier, the baby could be healthy, and more importantly, your rebound time is a lot less than having to have a C-section or things like that. So besides your consultation, next we dive into is a thorough examination. Your examination will consist of a chiropractic examination, maybe some orthopedic testing, but more importantly, some neurological testing to make sure everything's intact and safe for what we need to work on. What we offer here is typically with our new patients, we would do an x-ray. With pregnant and expecting moms, there's no x-rays taken because we don't want to harm you or the baby. So what we do is we evaluate your posture, because your posture is the window of your spine. It tells us exactly what's going on in your spine causing some of these aches and pains and discomforts you're having. So what we'll do is evaluate that posture, because as that center of gravity is going forward as you're growing, we tend to see a compressed back, upper thoracic spine that's tight, and your head that's going forward, causing a lot of neck tension, headaches, things like that. So after we evaluate your posture, we offer inside subluxation scans. Those scans are very thorough, not very invasive, but very objective on telling us how that nervous system is working and letting us know how much inflammation you have in your joints, as well as how hard your muscles are working and what we need to get some of that tension out of there. Okay. After your scans, we put that together and do a trial adjustment. This trial adjustment, which we're going to demonstrate a little later, is going to see how your body moves, how you're going to feel after, and that gets a little bit better idea of what we need to do to get you comfortable throughout the pregnancy and kind of get those goals met as we're going through that delivery process. Once we get all this done, we'll put together a comprehensive plan to give you what you need to make sure everything's functioning well, working well, and more importantly, you're feeling well. At that time, the girls should look at your insurance information, your benefits. That way, costs and all that stuff will be over with you at that same time. So if you have any questions, give us a call. Some of the treatment options, like we mentioned earlier, and what we treat as chiropractors is a condition called a subluxation. That subluxation is that big fancy word that tells you we have a bone that gets misaligned. Once that bone gets misaligned, especially in your lower back and your pelvis, what we tend to see is a lot of hip pain, a lot of back pain, some sciatica. But more importantly, when that bone is misaligned, a lot of times your birth canal is not as intact as it needs to be. There's a lot of torsion in the pelvis, which causes a lot of torsion in that uterus, causing some restriction for the baby to move. So as we're getting this pelvis and spine adjusted, not only is that getting rid of the pain and the inflammation, what that's going to do is it's actually going to help the baby able to move in position to where we need to, because there's less tension in there, less restrictions. So that's one of the big benefits of getting adjusted early. Another technique we use is a Webster technique. So this Webster technique not only allows us to get the pelvis adjusted and work on the muscles and the bones, but also the tendons and ligaments around there, because we want to make sure there's no stress or no tension on the ligaments so the baby could grow and there's no restriction in there. We're going to demonstrate a Webster technique adjustment a little later as well. Okay. Besides adjusting, which we treat here quite a bit and get great results with, is Dr. Haddock joined our practice a couple of months ago. Dr. Haddock brings with her 15 years of acupuncture experience. She's been providing for a lot of her patients, so that's an option that we could do here to get rid of the pain, the inflammation, get rid of those stubborn headaches and neck tension that you might be having. Also, a lot of our pregnant moms want to see, what can I do at home? So there's things that we could show you here in our office, stretches, exercises, to make sure you're as comfortable as possible and being proactive as possible as well. Okay. The next thing we do is we offer some nutritional consultations, because what we want to do is make sure you're doing everything properly to help you and your growing baby feel well and develop well. You know, we got different supplements that we can recommend, especially with the companies we use here that, you know, very thorough, very good companies that our only doctors could get access to. So we have that on hand as well. If you have any questions, like I said, give our office a call. We specialize in prenatal care, and we're happy to help in here to take care of you and your family. Thank you.